Hi, my name is Alex McDermott, and I'm going to perform the catheter care nursing skill. So the first thing I would do is provide privacy for my patient. I would wash my hands, and before that I would knock on the door and then I would check the order from the doctor, and I would make sure that it said I needed to give a catheter, and I do, so I would now identify the patient. So going over to my patient, hi, my name is Alex, and I'm going to be your student nurse today. And can I just see your wristband for identification? And your name is Jerry Jazz, and your date of birth is 3/15/1939. He says that's correct. And so now that I have the two identifiers, I can proceed. So Jerry, today the doctor has asked us to insert a catheter inside of you. Do you have any previous knowledge about catheters? And since he's had one before, he doesn't need any further teaching. So we could proceed with the care. He also just came back from a bath, so his peri area is clean. And for the purpose of this skill, Jerry will be a female. So since his peri area is clean, we're gonna have to expose you a little bit, Jerry. So we're gonna roll down his bed sheet. We're gonna raise his bed to a working level. About good. And then, since his peri area is clean, we'll just roll it up. And we will get his or her legs in the position to insert the catheter. Okay. So, now I'm going to open my skip kit and establish my sterile field. So this is a clean surface. My hands are already washed. I'm going to pull it out. Okay, this will be my garbage.
Alex, get the table like more towards you so you don't turn your back on it.
Okay, and so now I'm going to establish my sterile field, holding only the corners. And then we'll get my gloves on. I'm going to insert my gloves. I'll put my gloves on. Touching only the inner part right now. Okay.
No, don't grab it with that hand.
Oh, and we'll grab it with my other hand. Sorry, I touched this with my hand, and that would violate sterile technique. I would touch it with my gloved hand. Okay, and then we're gonna put this sheet down, shiny side first, and I can now touch this because my gloves are sterile. So let's just see if it pushes the shiny side. Okay. We're just going to turn it like this and put it right here under our patient. Okay. That actually was not shiny side down, so I would actually insert it the other way. I would redo that part and I would insert it the other way. Okay, and then this we don't need, but some facilities like us to use it. And now I will put these two pieces apart, and I can open my swabs right here. I have two sets of swabs. And I can perform care to make sure her peri area is sterile, so I just take one swab for each side. Dispose of that. Dispose of that. And then the last one will go right down the middle. And we'll dispose of that. Okay. And then I'm going to connect my water to the lumen of the catheter before I touch the labia, because it is easier to do with 2 hands instead of 1. Okay, now that's in there. And then I would take my lubricant out and I would squirt it into right here in order to lubricate my catheter. So I'm just going to really carefully keep this in here. Remove this plastic. Sterile. Okay. And then we're going to lubricate this right now, where I just squirted the lubricant. Roll it around there. And now that's lubricated, I can place this down in between the patient's legs. And I would insert the catheter, holding back the labia. Until I saw urine return. And then I would insert the water all the way to 10 for this one, and then I would pull a little bit, and since I saw that it stopped, I would push it back in a little bit. And I wouldn't force it in if it didn't go. And this is still my dirty hand. And then I would attach the catheter to the patient, and I would hang it on the side of the bed, making sure it didn't touch the ground, but it was below the level of the patient's bladder. And at that point, I would ask if the patient was comfortable and there's anything else they need. And then I would do my peri-care, remove my gloves, and this skill would be complete.